So today is a demonstration class of the kidney. So these are the specimen of kidneys. This one is the right kidney and this one is the left kidney. So now I directly move to the site determination of the kidney. For the site determination of the kidney, we have to look on the anterior surface. The anterior surface of the kidney is convex, whereas the posterior surface is flat. Here you can see the anterior surface is convex, but the posterior surface of the kidney is a little bit flat. So in this way we can determine the anterior and posterior position of the kidney. Then we have to look for the hilum of the kidney. This is the hilum of the kidney. It is present medially. The hilum should be present medially. And lastly we have to determine the upper and lower end of the kidney. The upper end of the kidney is generally round and broad, whereas the lower end of the kidney is narrow and sharp. And we can also determine the side of the kidney by looking at the position of the ureter. Here this is the ureter. This ureter should be present posteriorly. In the hilum the ureter should be present posteriorly. Here you can see this is the hilum of the right kidney. The ureter is present posteriorly and it should go downwards. So that means this is the lower pole. So this is the right kidney. In this way we can determine the left kidney also. You can see clearly this is the pelvis of the ureter. This ureter should be present posteriorly. Here it is present posteriorly. In front of the ureter we get the renal vessels. Here it is present posteriorly, and ureter is going downwards without any tortuosity or kink. So this is the lower end of the kidney. So in this way you can determine the side of the kidney. After this we have to discuss about the extent of the kidney. The kidneys extends from the T12 vertebra to the L3 vertebra, so that the hilum of the kidney are present at the transpyloric plane, and the transpyloric plane it passes through the lower border of the L1. Now different measurements of the kidney. Regarding the measurements of the kidney, the length of the kidney is around 10 centimeter, the breadth of the kidney is around 5 centimeter, and the thickness of the kidney is around 3 centimeter, and the weight of the kidney is around 150 gram in case of the adult. After that, now we will move to the presenting parts of the kidney. The presenting parts of the kidney, both the right and left kidney, they have same presenting parts. The kidney has an upper end and a lower end, a lateral border and a medial border. Then it has an anterior surface and a posterior surface. Now we should discuss each of these parts one by one. First of all, the upper end of the kidney. The upper end of the kidney is around 2.5 centimeter away from the midline. It is around 2.5 centimeter away from the midline, whereas the lower pole of the kidney is around 7.5 centimeter away from the midline. And this is the lateral border of the kidney. The lateral border of the kidney is convex in appearance, and this is the medial border of the kidney. The medial border of the kidney is concave in the middle part and convex in upper and lower ends. It is concave in the middle part because there is presence of the hilum of the kidney, and the structures that passes through the hilum are the renal vein, renal artery, and the pelvis of the ureter. So anterior to posterior, the structures has to be remembered: renal vein, renal artery, and the pelvis of the ureter. Here, due to presence of the lienorenal ligament and the associated adipose tissue, the structures are difficult to identify. Still, here you can see that if we remove this tissue, then we can clearly see an opening over here. there is an opening over here. So this is the opening of the renal vein. Next to the vein, there are some small branches. There are small branches over here. These are nothing but the branches of the renal arteries. And finally, the posterior most structure is the pelvis of the ureter and the ureter itself. So this is the arrangement of the structures in the hilum. Now move to the anterior surface of the kidney. This is the anterior surface of the kidney. The relationship of the anterior surface of the kidney is different in right and left one. So first I will discuss about the right one. The anterior surface will be related in the upper end to the suprarenal gland, then on the lateral side to the liver, and this liver and the kidney are separated by the hepatorenal pouch of the Morrison, and the medial part nearby this hilum, this portion will be related to the second part of the duodenum, and the lower pole of the kidney is related medially to the coils of jejunum and laterally to the right colic flexure. Now come to the left one. In the left one, the relationship of the anterior surface are similar to the right, but there are some differences. First of all, the upper pole will be related to the left suprarenal gland. Then along this lateral border, this portion in the upper part will be related to the spleen, and the adjoining medial part will be related to the stomach. Then below these two structures, this portion above the lower pole, this portion will be related to the pancreas. And the lower pole, like in case of the right kidney, will be related to the coils of jejunum on the medial side and the left colic flexure on the lateral side. So this is the relationship of the anterior surface of the left kidney. Now move to the relationship of the posterior surface. The relationship on the posterior surface is almost similar for both the kidneys. The upper part of the posterior surface will be related to the 12th rib in case of the right one. Then the middle portion will be related to three nerves. From above downwards, the nerves are subcostal nerve, iliohypogastric nerve, and ilioinguinal nerve. And the lower portion of the kidney will be related to three muscles. From medial to lateral, the muscles are psoas major, quadratus lumborum, and the transversus abdominis. In the left kidney also the relations are similar, except that the upper end on the posterior surface will be related to two ribs. Here it is 11 and 12, because the left kidney is slightly upper in position, so it will be related to two ribs. Then this in the middle portion, similar to the right one, we will have three nerves: subcostal, iliohypogastric, ilioinguinal, and the lower part will be related to the three muscles: psoas major, quadratus lumborum, and transversus abdominis. Now let me show the anatomical position of the kidneys. So this is the right kidney. The right kidney should be on the right hand, and the upper end of the kidney should be directed medially, and the lower end of the kidney should be directed laterally, and the medial portion of the kidney is forwardly directed because the kidneys are placed in the paravertebral gutter. That's why the medial end of the kidney is anteriorly located than the lateral aspect of the kidney. So this is the anatomical position for the right kidney. Now I will show the anatomical position of the left kidney. The left kidney should be on the left hand, and the upper end of the kidney is directed medially, and the medial end or medial portion of the kidney should be directed slightly forward. So this is the anatomical position for the left kidney. So now let us discuss about the coronal section of a kidney. So this is a kidney. Now we do a coronal section through the lateral border of the kidney. Now we unfold the kidney. Here you can see that there are some pipe-like structures are present medially, this portion is known as the renal sinus, where these pipes are present. It is a space within the kidney, and the remaining part of the kidney is known as the renal parenchyma, or the substance of the kidney. First we will discuss about the substance of the kidney, or the renal parenchyma. The renal parenchyma is divided into outer cortex and inner medulla. The hallmark of the medulla is the presence of renal pyramids. You can see over here these small structures, these pyramid like triangular structures which are present over here, which will continue medially as the pipe, which will be known as the minor calyx. So this area, this triangular area, are known as the renal pyramid. So they form the renal medulla. The base of the renal pyramid, this is one renal pyramid, this is another renal pyramid. The base of the renal pyramid, is directed towards the surface of the kidney, whereas the apex will form the renal papilla, and this papilla will open into a minor calyx. So this is one minor calyx. Then 2 or 3 such minor calyces join to form one major calyx, and 2 to 3 major calyces ultimately join to form the renal pelvis. And this is the cortical area. The cortex, which is present just lateral or just on the periphery of the renal pyramid here, this is known as the cortical arc. And the parenchyma, which is present in between the renal pyramids, that means the cortex which is present in between the cortical arches, it extends between the renal pyramids towards the renal sinus. So this part of the cortex is known as the renal columns. One renal pyramid along with the surrounding cortex is known as the lobe of the kidney. And here you can see this is the pelvis of the ureter. This pelvis of the ureter is formed within the renal sinus. So this space within the kidney medially is known as the renal sinus, where the major calyces join to form the renal pelvis. Here you can see there is one major opening over here, this one, through which I am inserting the forceps. This is the major opening. This is the renal pelvis. This renal pelvis will continue down as the ureter. This renal pelvis is formed within the renal sinus by union of 2 to 3 major calyces. For example, this will be one major calyx. This is one major calyx which will open down into the renal pelvis. These major calyces are in turn formed by union of few minor calyces. So this is one minor calyx, and this is another minor calyx. And this minor calyx, they drain through the renal papilla, which is present at the apex of the renal pyramid. And these renal pyramids, they form the renal medulla, whereas the cortical arches and the renal columns, they form the renal cortex. And renal pyramid surrounded by the cortex of the kidney will form one lobe of the kidney.